Dr. Andy Hickson, and this is Bully Box TV Hard Talk Interview. With me today is Professor Sue Jennings. Sue, if I can call you Sue, welcome to Bully Box TV.
Thank you.
I'd like to ask you a question, first of all, about your work on drama therapy. Now, could you just first of all explain to us what the word drama therapy actually means?
Indeed, and my reply is going to be a fairly personal one because lots of different people have different definitions of drama therapy. But the main development of drama therapy happened in this country and is now established as a state-registered profession. But what it is where with groups of people who have different special needs, people with learning difficulties, people with behavioural difficulties, where drama is used as a way of them coming to terms with who they are, how they are, and changing how they will be. But I think where I want to develop this discussion is not separating drama therapy too much from play therapy, because drama for me is play. Drama therapy and play therapy are very close to each other. And we seem to have this rarefied idea in this country that play therapy is nothing to do with drama and it's all to do with children and their difficulties. Whereas if children had the opportunity to play more, there'd be less need for play therapy. If children had the chance to do more drama, there would be less need for drama therapy. So I'm really talking myself out of a job. Play and drama are the mental health preservers in all cultures, in all societies, right across the educational spectrum. Now, we use all the techniques that any drama teacher would use: movement, mime, role play, theatre work, text work, poetry, improvisation, all of these. Any drama teacher would use those as a skilled drama teacher, but we apply those with special groups of people, not just children but adults as well.
Can they be running with mainstream groups?
Well, some people are running drama therapy groups in mainstream schools as a way of improving mental health, improving people's outlook on life, particularly when there's going to be exam pressure and additional tension. But the main work is in terms of special needs education. And that can include people with profound learning difficulties as well as people with milder issues, people really who've been challenged for their behaviour and way of being in school and are often excluded. And a lot of work is done with children with emotional issues, including those who've been abused, in whether it's sexually abused, whether it's physical or emotional abuse, or all three.
So, in our context, we hear about a lot of children who have various special educational needs suffer bullying. Now, how can drama therapy help people with special educational needs deal with issues of bullying?
It's a very important area of actually using drama therapy. And it's not to do with acting out what the bully did or my history of being bullied over 5 years. It's to do with helping someone to develop another role from that of the bully's victim. Most people who are bullied feel victims, they feel victimized, they often feel helpless. And a lot of our work is empowering people to develop new strengths, new identities, new self-image, so that they are then better equipped to deal with the bullying themselves. But too often, whatever sort of bully we're talking about, whether it's a group or an individual or cyberbullying, whatever, end up demoralizing people. And once you're demoralized, you feel very helpless to do anything about it. So we're into using things like positive psychology, for example, rather than focusing on difficulties, focusing on health and strength.
Okay, but it sounds very airy-fairy. Are you really dealing with real issues, or are you just sort of playing games and having a bit of fun in the classroom and making people feel good for the day, so to speak. Long term, are you actually really helping people deal with the real issues that affect their lives?
Well, I see nothing wrong with people playing some games, having fun and feeling good for the day, because all the days before that may have been appalling. They may have had nightmares, they may have had thoughts of suicide. To actually have some fun for a day is great. It may not deal with the subject at depth, obviously, but that is where we're doing ongoing work, encouraging groups of children or teenagers who've been bullied to also help each other and not just themselves as individuals. Because often when people talk about it, they say, oh, well, that happened to me as well. Immediately you've got a coming together of like-minded people. But the hard-nosed facts of bullying, of what actually happens, means that we actually have to understand the bullying process. So we use a lot of text work in our work, where rather than focusing on the person's own life and what happened to them, we will take a story, whether it's bullying and teasing, demoralisation and so on, where there are issues between parents and children, for example. And by working with that distance of the text, people feel safe to really look at different possible solutions. By using drama therapy, one can find positive ways to build confidence, to build new ideas of identity, and to actually equip people with the type of social skills needed to deal with bullying. And bullying isn't just a thing on its own, it's in the much bigger context, probably of the whole life at school, the whole life at home, previous history, where a person has found themselves trapped, whether child or teenager, in a cycle of not feeling good about themselves, of waking up in the morning and actually dreading the day. I think drama and drama therapy are invaluable in this whole area, that we can wake up in the morning and actually look forward to our day, which surely is what life's all about. Unfortunately, a lot of drama work is considered airy-fairy by governments and schools who choose not to have drama in their school. In my own experience, once these teachers have experienced what drama can actually do, they actually realise it's fundamental to learning. Just as some teachers find it quite hard to understand drama, equally they'll find it hard to understand drama therapy. Because drama for so long has not been considered a science, it hasn't been researched scientifically. Well, that's actually changed now. There's a lot of research, a lot of doctoral work that's gone on that actually proves the benefit of using drama in the classroom. One of the unfortunate aspects for me is that teachers more and more are having to be bureaucrats, fill in forms, do assessments, more than they ever used to before. And I think teachers themselves are often demoralised. I think they almost feel victims of the system. And the idea of drama, that's going to take more time, more energy, they can't think about it. Whereas people who've joined in drama workshops find they discover more energy, not less. That there's a way of drama being a stimulus for them to think about things in a new way and to enhance other subjects, whatever the subject is, even a very academic subject. Because don't forget, we're working with both halves of the brain. The left hemisphere of the brain, which is to do with facts and logic, numeracy, literacy, and the right hemisphere of the brain that is to do with creativity, with intuition, with hunches. Now, a lot of education focuses on left hemisphere learning of the facts, the rote learning, the numeracy and literacy, and the new proposals by government are talking about back to basics, meaning those left brain activities. I mean, creativity and creative thinking and creative understanding, let alone the arts, hardly get mentioned in new proposals for education. So, whereas we have the proof now, it is not being listened to either by education authorities or central government, and I think that is to its detriment. That we should continue to get more and more children being excluded, more and more teenagers who are disaffected.
Am I right in understanding that drama therapy does not only help the client, but it also helps the drama therapist.
Oh, indeed. I wouldn't question that at all. And I think drama therapists continue to grow by working as drama therapists with different groups. And it can be that something going on for a student or a pupil has similar issues in their lives that the therapists themselves have, which is why we need supervision to keep everyone safe. So, for example, somebody in a session who might have been bullied by a member of their own family, a grandfather, who knows whether the therapist might have had that experience as well. Now, on the one hand, they can be helpful because they know what it was like. On the other hand, they can get in the way of the person rather than paying attention to the child or teenager's own story.
So what is the difference between drama therapy and psychodrama?
That is one of the biggest questions of this and the last century, as people struggle with that. As I see it, and maybe not everybody would agree with me, psychodrama very much is working directly with the issues of the individual person in the psychodrama group. So if somebody is having issues with their mum, then somebody in the group volunteers to be the mum, somebody else volunteers to be other members of the family, and they try to recreate the actual situation where things were going wrong. And then the psychodrama leader will suggest ways, well, maybe we could explore this in a different way. Maybe you could role play your mum and see if you could understand a bit more why she was doing what she was doing. They're working specifically with the event. Now, drama therapists very rarely do that. Drama therapists believe in creating some distance, just as theatre does, so that the individual can feel very safe working with the story, the play text, the metaphor. To work through a metaphor of what's going on for me is a much safer but nevertheless very deep experience. The more we can distance using the drama, the paradoxically the more we can come closer.
If a school wants to book a drama therapist to work in the school, either on a part-time, a temporary or a full-time basis, maybe to work with children who are suffering bullying, how would they go about that?
Very easy. They would log on to the website of the British Association of Drama Therapists, and there are sections, find a drama therapist, for example. So that's a way to do it. Also contact the local health authority and find out, is there already a drama therapist perhaps working part-time in the area?
How do you know if it's a good drama therapist?
Well, first of all, to call yourself a drama therapist, you have to be fully qualified. You have to undergo additional training and supervision after your masters that you've gained at college. All drama therapy training courses have to be government approved by the appropriate health body. Then a drama therapist is not allowed to practice unless they've done one of these trainings, and it is an extensive and intensive training over 3 years, ending up with an MA. It's a postgraduate course. And what's more, drama therapists have to have clinical supervision of their work as long as they practice. It's a law. So that's one of the best indicators. But interview your drama therapist. Ask them how they might fit in. Some drama therapists might not have worked in schools, so you need to check out that they have got educational experience. But interview them and see whether they feel right for your school.
If a teacher doesn't have any experience of drama therapy or the benefits of drama therapy, but have just heard that it might be a good person to bring in, maybe you could just give an example of some of the key questions that you might want to ask a drama therapist if you're going to interview them.
Right. Well, obviously, first of all, you would have seen their extensive CV, you would have seen their references, and it's perfectly okay to ask for a reference from their supervisor who will know their frontline work. And you would obviously really exclude people who hadn't got school experience at some point. So that would be how it would start. And the thing is, to give them at interview a situation and ask them how they would deal with it as a drama therapist. You might get a small group from a class in, showing a situation of bullying, for example, or intimidation, and ask the drama therapist not to run a therapy session, but to show how they might deal with that. The important thing is the teacher and the school get the right person, and the drama therapist has got to come up with the goods, and if it doesn't feel quite right, you'll interview somebody else.
Now, as well as developing theories of drama therapy, you've also touched on some additional complementary concepts, and I wondered if you'd just tell us a little bit about them, particularly in reference to how it might help people deal with bullying. The first one I've heard is called EPR. Tell us a little bit about EPR.
Well, some people think it stands for electronic patient records, but in actual fact it stands for embodiment, projection, role. Now those three words follow the development of any child from birth to 7 years. That the first year of life is very much to do with physical and sensory experience. The second and third year of life are very much to do with projective experience, things out there, building, drawing, making puzzles and so on. And then the fourth year of life is much more to do with developing roles. And every child that you meet, unless there has been some damage in their development, will go through those three stages. Therefore, it's a very useful observation tool to see, is a child just not engaging at an embodiment level at all? They won't respond to anything physical, they shy away from anything sensory. Or will they not want to really engage with the dramatic play and drama? So you can use it as an observation tool to look at a child's development. But if you want to make some type of change, you can use EPR activities to actually address children's issues because it is their normal development pattern. Now, neurodramatic play I've developed more recently.
This is another of your theories,
yes.
NDP.
Yes. Is neurodramatic play, because I realised that the embodiment stage I was referring to in a much too general way. And with all the developments of neuroscience, I re-looked at that whole development, particularly in relation to the attachment between child and mother. We know a lot about attachment. We know that children who have healthy attachments thrive. Children who have chaotic or rejecting attachments don't thrive. That's fact. That's accepted across schools, clinicians and everywhere. But I was looking at when does it really start, and with my own observations I feel that attachment starts even before the child's born, with the mother's relationship with her unborn child, and that attachment starts to get established first and continues right through, almost exclusively with the mother during the first year of life. Other theorists say that it develops during the first year, isn't established until 1 year old, and I hotly dispute this. This attachment, or what in the old days we'd call bonding, starts virtually from conception. So neurodramatic play focuses on this 6 months before birth and 6 months after birth, and it has three very important components. One is sensory play. The child likes to play in a messy, sticky way. Children like to play with their food, they like to dribble, they like to play with their spit and so on. And unfortunately, with the invention of wipes, people think they should be cleaned up all the time, when actually this messy play is a way to finding order. You make a mess, you have chaos, and out of that you learn about order. So it's a very important stage, the messy play. The second part of NDP is rhythmic play. And the heartbeat of the mother and the heartbeat of the child are very important starting points. And not many people know that after a baby is born, when the mother's holding it on the shoulder, they will often adjust their own heartbeat to the heartbeat of the mother. So they've got a joint rhythm. And that's really important too. And of course all those very early songs of pat a cake and so on. And the third part of NDP is dramatic play. Now people think drama starts later, but dramatic playfulness actually starts a few hours after birth. And we can now see, we've got video evidence that a baby of a few hours old will try to imitate the mother's expression. So imitation is the first step of drama. So and the mother will imitate back. So you get this sort of echoing back and forth of each other's sounds and expressions. So I will be as bold as to say that rather than civilization being founded on language, I believe strongly that civilization is founded on drama. Hence the very first dramatic act of the child a few hours old.
Is there anything else that you would like to say in relation to your theories or drama therapy or play therapy that might help teachers or students who are watching this programme deal with issues of bullying in their school?
Well, just to reiterate something, I think first of all every school needs to have a very clear policy about bullying.
But that is required by law in this country.
But sometimes it's a token exercise, sometimes it's an in-depth training with follow-up training and follow-up awareness. I think children need, even if they're not experiencing bullying, to understand what bullying is and to understand how to be a friend to somebody who is being bullied. Sometimes it's your mate who will speak up for you if somebody is being cruel, for example. So this early training and experience, I think, is very, very important. That's my first point. Secondly, if only we could all lobby central government and the education authority to value the undoubtable necessity for drama work in schools, there would be a lot less of these major issues.
Just one more question I think I have for you. In relation to bullying, at what age do you think a child or a baby or a toddler can bully somebody else?
Well, based on my own personal experience, and it may be even earlier, I remember at the age of 3 treating another child very cruelly. And I also link it to the fact that within the previous couple of months I had been treated very cruelly as well. So somehow it was okay because that had happened to me. What we need to remember is, according to the psychologist Erickson and the 8 stages of development, that trust is formed in the first 18 months. Now, the child that is born into a mistrustful environment is already in preparation to be a victim of bullying. Bullies pick out children that don't feel confident, that don't seem to trust other people, that are wary, that are scared, and so on. So the roots of it start at 18 months. And unfortunately, if a child is born into a bullying family, all those indicators are set up straight away. But certainly by the age of 3, a child is capable of bullying another child.
Thank you. If people want to find out more about you or your work or drama therapy and some of your theories, how can they?
Go to my website, www.suejennings.com.
Okay, and do you have a Facebook page?
Indeed, drama therapy and creative care.
Brilliant. Professor Sue Jennings, thank you ever so much for joining us today on Bullybox TV. This has been Dr. Andy Hickson from Bullybox TV. Join us next time for one of our Hard Talk interviews. Thank you.